Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we had Dr. Nabil El Sanadi on our show previously, and he is really the man of the hour. And he is doing so many things for Broward Health and for people in general. Of course, he always likes to talk about the patients. Every time you bring up the doctors, he keeps going to the patients. So I'm forcing him now to talk about the doctors.
Okay, all right.
Because
ANITA, thank you for having me on the show.
It's such a pleasure. It just brightens up my whole day, and I know people listening to you, they're hanging on to, because not everybody gets to hear you, and it's nice. You know, You're just a name up there, doing things up in the ivory tower, so we want to bring you down, too.
I think it's unique, a doctor that's an administrator. So
I'm
like a little novelty, you know?
A big novelty.
Yes.
Let's talk about those doctors. I've had a lot of doctors that I've been working with. I've had them on the radio show. I have one particular, Linda Hughes. Dr. Hughes has been just spectacular. She was just at our last Cure symposium. But who is the one who brings the doctors on? So let's say you're training doctors.
Right.
Do you have an input in this, or does each of the CEOs at the hospital? How does that work?
So it's a team effort whenever we bring doctors on board. Of course, the ideal thing is that the medical students that we train go to residencies and get the specialties that would help us as far as the community, and then they'd move back to the community and come in. That's the ideal pathway. Medical student to resident to coming back to the community to serve the population. And when we go recruiting, we actually talk to the individual CEOs at the different facilities and say, what does your medical staff need? What do your patients need? Do you need a geriatrician? Do you need somebody that takes care of people 65 and over? Do you need a pain management specialist? Do you have a huge population of people that need pain management? Do you have a big pediatric orthopedic population? We were going to go recruit one of those, or two of those, or three of those. So it's an issue of supply and demand. And the demand is usually the hospital CEOs and the primary service areas for the hospital. So, for example, for Imperial Point, we're focusing more on geriatrics. We're focusing on pain management and palliative care. We're also focusing on cardiology and orthopedics. That service area for Imperial Point needs those kinds of specialties and more of them. So we're trying to build that. At North Broward Medical Center, same kind of thing, different flavor as far as neurology and neuroscience. People that may have a combination of things that are affecting their mind. Depression, polypharmacy, too many drugs on board that make them tired and confused and maybe depressed, or the possibility of, God forbid, something like Alzheimer's. So we need to be able to sort out what does the patient have, can we help them out? So that kind of combination specialty, neurology, neuroscience, psychology, and so on and so forth. And of course, when we talk about Coral Springs, it's Parkland and Coral Springs, the changing dynamics as far as the age of the population itself, more pediatrics, more children, more young adults. So we're focusing that there. And, of course, the downtown hospital, Broward Health, a little bit of everything. We have everything. We need more of everything. We have a vibrant, growing community. Florida is actually now more populated than New York. We have more people in Florida than there is in New York, which is amazing to me. I think they're just moving down. And because of that, we need to ramp up the healthcare system to meet the need of a growing community, plus medical tourism. So we're looking at that.
Well, we're going to talk about medical tourism in just a minute. I'm glad you brought that up. But let's just move back. I want you to clarify something. So the doctors, when you say to a CEO, we need this type of specialty, are they going to be hospitalists, or are you going to groups, let's say a cardiology group, and bringing them in and saying, would you like to work at our hospital?
Right. So different flavors. You know, we can go to a hospitalist group. They'll come in and do a turnkey operation. For example, at Imperial Point and at Coral Springs, we have internal medicine hospitalists that take care of patients in the hospital. So that's one way to do it. Another way to do it is to go to individual doctors and to say, hey, doctor, we need more of ENT, or we need more of orthopedics. Would you be interested in joining our hospital system and our practice? And then talk to them to either employ them or have a contract with them. Or we can go to groups. My goal is to actually go to pre-established groups in the community that already have patients, and to say, how can we help you create stickiness between you and your patients? And then how can our hospitals be your preferred hospital system to serve you as a doctor, what your needs are, and also your patients? So those are the three approaches, basically.
And I just heard that there are so many students trying to get into medical schools, because for a while they're saying, because the people can't make money anymore, they're not going to be doctors. Right. That's not true, is it?
No, it's not. Medical schools, and there's new medical schools. FIU just opened up a medical school. Nova has been around for a while. They're opening up an allopathic medical school. That's the need, supply and demand. We need more medical students to graduate to become more doctors. So the ratio is 13 to 14 to 1. For every 14 people that apply, one person gets in. And they're usually the best and the brightest. They're very motivated. And sometimes what I tell people, young kids, my children, it's easier to make a lot more money someplace else. But to be a physician, clinician, you're actually doing work where you're helping humanity, you're helping other people, you're helping your friends and your family and your community. So being a healer and a physician is a privilege. It's not the money. It's the privilege of being able to help people from that dimension.
That's the way it used to be.
That's the way it should be.
People were paid with chickens and eggs. And
the barter system.
The barter system. Yeah. But no, that's...
For an appendectomy, you get paid 5 chickens.
Right.
Someday, someplace, that used to happen. So,
well, coming from Egypt, I'm sure that was something, too, that you can't recall, but your family. You actually did you actually live in Egypt?
Yeah. I grew up over there. Came in when I was like 9, 10, that age group. So I remember quite a bit. I don't quite speak the language as they speak it. I speak my vocabulary is locked in at a 9 or 10-year-old's vocabulary, but I still speak the language.
And have you been back?
No, I haven't been back. Believe it or not, I'm an Egyptian Christian, and I'm afraid to go back.
It's too dangerous. Absolutely. No, you're right.
Yep.
But I remember going to Egypt and seeing gorgeous museum, which is, I know, and we just hope that nothing is going to happen to that museum. It was spectacular.
That's history, and that's like humanity from 5,000, 7,000 years ago, and museums preserve that so that as we go forward in time, we learn what happened in the past and learn something.
Seeing the pyramids and seeing that was
it's a beautiful country.
No, it is. It is wonderful, and I'm glad that you're here to. Keep the customs alive in some way. I don't know. Is your wife Egyptian?
No, she is a born and bred Midwesterner. She's from Iowa.
But have you taught her how to cook Egyptian food?
I don't cook, but she's trying to learn.
Because it is a special kind of food.
It is a special kind of food. Yes,
right. Well, that's okay. So she can cook one thing and then.
Yes.
Okay. Well, I always like to have, when I have physicians or certain people like you, I just like to liven it up with the family a little bit, because people always want to know what your family's like and what's happening. All right, so let's go back to the doctors, because I only heard of an interventional radiologist probably 3 years ago.
Right.
Maybe it's a new specialty.
Well, so there's a lot of new things as technology
so
comes
tell
on
us
board.
About
yeah,
them.
absolutely.
Tell us about them.
So think of being able to do X-rays. But just within our lifetime is when X-rays were invented. Marie Curie and so on and so forth. So as technology, now we have not only just plain X-rays, we have CAT scans, and now we have MRIs and ultrasound. So as technology improves, the more medicine can do for individuals and for patients. And with that, I think that's the driver. Informatics technology, as far as being able to apply that to better patient care. So interventional radiology is where a radiologist, somebody that used to read X-rays, can actually use devices to go into the blood vessels and maybe open up a leg artery, the popliteal artery that's blocked up with cholesterol. So that's what they do. So instead of just reading the X-ray, they can actually use a needle, thread a balloon through it, look at it under fluoroscopy, which is a special kind of X-ray, expand the balloon and open up the artery instead of having that patient have to go to surgery. So new science, new technology, better patient care. Things like looking at pain management, the new kind of medications that we have and the different levels of pain that people have. We're able to match the medications better to the level of pain the patient has.
Because I just want to say, because unfortunately a lot of people get on the pain medicine and they can't get off.
Yeah, and that's a problem, because once somebody gets on pain medicines and they may be dependent on it too much, their body doesn't heal as well or as fast, because you're treating the symptoms and you're not treating the illness itself. So it's a challenge to be able to manage the person's pain but also manage the underlying disease process.
So that's a specialty that a physician
Correct.
understands that.
Yes, yeah.
And that's really
and be able
important.
to sort through that. And what allows that specialty to grow and to flourish is the different levels of pills that we can give. So we can give something like morphine or Dilaudid, which is for very strong pain, or we can give something as little as an aspirin or ibuprofen for small pain.
Or even recommend acupuncture or something else.
Different kinds, yeah, of course. And I don't know if you know or not, we have a spa in our hospital.
Oh, I've been there. Tell everybody about
exactly,
the spa.
taking care of that dimension as far as not just the pain, but also providing comfort. So that's another element we provide.
And can people come from the outside to go into the spa?
I don't think so. I think it's
Not
for our
yet.
patients. Not yet, exactly. So, but we're in the healing business, not quite the comfort business. So,
So someone is having, because I know that's down at Broward General.
right, that's correct.
And that's unusual, and that was something you're very proud of. I've been there, and you walk in, and everything is like it is a spa.
It is a spa.
And
So
that's where it's really, I thought it was where the women's health is.
that is correct. So we're actually doing different product lines and service lines. So we have specialists in women's issues as far as breast cancer, uterine issues, ovarian issues, aging, hormone changes. So we have that. We actually do a Mamapalooza, which is going out into the community and doing mammograms to do preventive medicine. We have specialized men initiatives like the Man Van and focusing on prostate cancer and so on and so forth. And for the audience, the Man Van doesn't deliver men. So just know that it's for the wellness and welfare of men, but it's not something that you call up to deliver 2 men to your household.
Well,
Or 3 men.
that's right. But I think it's a good point that you brought up about the men. Why is it, and is it just rumor, or why is it that men aren't so quick to go to the doctor? And that's why the van was brought, because it comes to them. And
Correct. So when you think of the concept of men's health, traditionally in the American household, the women take care of the children, they take care of the household. The men are the wage earners. They're out there, they're working, very stoic, very stubborn. You got to go see the doctor. No, I'm too busy. I've got, to put in overtime on Saturday, that kind of thing. So what we're trying to do is we're trying to reach out into the community and send a message out that wellness and prevention, an ounce of prevention is worth a pound of cure. Let's see if there's the beginnings of colon cancer. If there is that, let's catch it early. Let's see if there's prostate enlargement. And if there's a prostatic enlargement, could it be something else? Let's take care of that. For women, mammography. If there's a shadow or a nodule that we need to take care of, it's always better to catch things early. And that's what we're trying to use our huge healthcare system, 1,500 beds, 9,000 employees, over 1,800 doctors, to basically infiltrate the community and send a message out. We're not trying to put ourselves out of business. We're just trying to make you healthier. Join us on that journey to try to make you healthier. Try to use the resources. Let's see what we can do if we catch something early.
so if someone would be in the hospital 3, 4, 5 days. They had, hip replacement, knee replacement. Now they're shipped out very quickly to rehab centers.
Yes.
Do you have rehabilitation right there in the hospitals?
Yes, absolutely. So we're fully integrated, a full-service system where we have all the things that a person would need to go from either an acute injury or illness, a heart attack or stroke or a broken hip, all the way to wellness. And then if they need rehab, we have in-house rehab. Plus then if they need long-term, we have access to facilities where we can place them. So we have all of that. And we do that for all the service lines and product lines, whether it's cardiac, neurology, orthopedics. So fully integrated, vertically, basically solid. It's a good service that we provide from stem to stern.
And nurses.
Yes.
You're always talking
Our most
about
precious
doctors.
resource, yes.
And of course, I know that Alice, who is the CEO over at the Imperial Point, she just brags about her nurses. I mean, that's her biggest thing, because it's what's called NICE or NICE.
Yes. So what they did, they got an award. They have been nationally recognized as a center of excellence for nurses, for nurse research, nurse education, and nurse clinical practices. So this is something that we're very, very proud of across the system. Of course, Allison at Imperial Point, they've done a superb job to showcase the great clinical staff, the nursing staff that they have, and I'm trying to make that spread across the system so that those standards at Imperial Point permeate, North Broward and Coral Springs and Broward Health Medical Centers. So nurses are the front line of the provision of healthcare.
No, they are, and we all understand that because many physicians have to deal with so many patients, but a nurse, and there's something about a very lovely nurse. Now, not, all people have different personalities, but a lovely nurse can really, even some will say, I don't need the doctor, you just come and take care of what I have to do.
We hear that all the time. The nursing is so outstanding, and we appreciate the doctors, but what got given to us at the bedside is an angel that took care of us. It's a nurse that held our hand and started an IV and it didn't hurt and so on and so forth. So, and we appreciate that.
And something else that I think we really have to applaud, yay, are the volunteers.
Oh, the volunteers are an amazing part of the system. This is people that give parts of their heart and their soul, their time and their money to come and to help us take care of the community and the patients. So they're not only are they precious, but they're amazing people. They're my heroes. When I grow up, I want to be just like that, where I can give freely.
You're never going to grow up, don't worry about it. Go ahead.
I like to play too much. You're right. So, but big picture-wise, they're there. They give their time, their energy. They're like the glue that holds the front end of the system together, which is, again, we appreciate them so much.
And so for those of you listening, you are listening to Dr. Nabil El Sanadi, who's president and CEO of Broward Health. All the hospitals and everything goes on in Broward to do with health. And we're talking now about volunteerism. And so if that is something you would like to do,
we would love to have you come on board.
We would love to have you do that. And all you have to do is go on the website, browardhealth.org.
Yes.
And on the website, there'll be opportunities for so many things. You'll learn about everything that Dr. El Sanadi was telling you about. I wanted to back up a minute because when my mother was living, we went to, at the time it was called Broward Health North, or I know the name changed a little bit.
North Broward Medical Center to Broward
right.
Health North. I better say it right.
So I took her to what was called the Memory Disorder Center, but I did not tell my mother that was the name.
Right.
We don't want to disorder. I say, Mom, it's the memory center where you're going to get a better memory.
Yes.
And I know Dr. Todd, who is still there, and it really, they were early. Nobody else was doing what they did. Yep. So it's only appropriate now that the neuroscience division really gets a lot of...
becomes more robust.
Yes,
and gets a lot of support. And we're doing that. We're doing that every day, and we will continue to do that. Equipment, supplies, nursing staff. We have, of course, Dr. Todd was the pacemaker. He's the guy that was at the lead, the tip of the spear, at the cutting edge, if not the cutting edge. We have a staff around him now. We have another neuro-interventional physician. His name is Dr. Ridwan Lin. He's actually using cutting-edge science to expand the scope of the practice as a comprehensive stroke center at North Broward. And so Dr. Todd, his legacy and his practice is very, very important to us. But we need to add more, and we are doing that.
Have you ever heard him speak?
Oh, absolutely. He's one of my heroes. He's also one of my mentors.
He said things, and I was saying, does everybody know he's saying these things?
Yes.
Yeah, he is terrific.
He's brilliant.
He is, and he's very funny, and that really makes a difference when people speak. But I just hope that, and I guess what you're trying to do is each hospital maybe have a specialty. It sounds like that's what's happening.
Each hospital has its own crown jewels that we'd like to showcase. Of course, each hospital is a hospital. We do everything at each hospital, but we work as a system. So if one doesn't provide something, patient can always be transferred or referred to another part of the system. The biggest thing that I'd want to leave with the listeners is that it's a huge healthcare system that has everything that belongs to you. The taxpayers, the citizens, we are here to serve you. Our doors are open. Any healthcare need, from wellness, prevention, all the way to acute intervention, inpatient care, post-acute care, rehab, but we do all of that. So it's a one-stop shop if you're ill. We also want to keep you healthy. So let us know. Get on the website, browardhealth.org, and look at it. And, if you want to volunteer, we'll take all ages, from teenagers that are able to function as transporters or help some nurses, all the way to people that have extra time after they've retired. Have them come in. Have them come and experience the healthcare system, help us provide the care.
Yes, and they have valet service.
Yes.
So
definitely.
you don't have to worry about trying to park.
Yes.
That's really very lovely. I know they have that down. And the other question I have, so if someone has we hope they'll have compliments, but let's say they have a complaint.
Right.
Where do they go with this?
So very important. You can actually get on the website, browardhealth.org. You can reach through that. or you can call the individual administrators. So, and I can give phone numbers, but they're all on the website. And I think big picture wise, we want to hear if there's any issues as far as the care that we provide. We only get better when compliments are nice. We love to receive them. Thank you for sending us compliments. But when we have something that we did that we shouldn't have done, or something that we could have do better, we definitely want to hear about that. We actually started doing something called safety and satisfaction rounds, where I go meet with the administrators and the different support staff at the individual facilities. Safety and satisfaction. Satisfaction for patients, for doctors, for paramedics is very, very important. We want to hear from you. We want to know how we can do things better for you and for your family. What we would do better for you may have a spillover effect where we can do better for everybody. So we want to hear from you.
And Dr. El Sanadi really means this. I mean, we're going to put this on YouTube, and I didn't bring in TV cameras so that you could see him do this maybe the next time, but because
I use my hands too much.
I love that, but everybody likes that. It's I'm sure
They're
Shark
connected.
Tank.
My brain, my mouth, and my hands are connected.
You're terrific. You don't have to change one iota.
Thank you.
But just understanding everyone, we don't want you to be sick. But
Correct.
if you are and you live in Broward County, you're very, very fortunate.
Yes. And if you don't know if you're sick or not, or if you have questions, get on the website. Call us. We will help you kind of walk through. Of course, if you have an emergency, and as I'm sure you hear on every doctor's office recording, if you have an emergency, call 911. But if you have questions about healthcare, how to access the system, where to go, how to make an appointment, which specialties do we have, help us help you find providers in our system.
Yeah, it's funny, what did we do before the World Wide Web? I mean, I have no idea. The cell phone that you have in your hand,
Yes.
the cameras that we used to buy, these expensive cameras.
Technology is driving where we are.
And then one thing I don't think we covered yet, but it was the robots.
Yes. Oh,
Let's go to robots.
Yes. Everybody wants a robot.
Right,
All it is like toys for the doctors. So what we've done is every doctor that thinks that they need a robot to take better care of their patients, they're asking for specific kinds of robots. So at North Broward Medical Center, Broward Health North, Pauline Grant's shop, we just got a robot for orthopedic surgery.
And Dr. Jenke.
Dr. Jenke and
right.
Aid, yes. And they actually, again, it's being on the cutting edge, using technology to practice medicine better. And the robots do help people as far as being more precise, more accurate, and patients usually go out of the hospital sooner. They don't have to spend, because they don't have the bigger scars. They have smaller scars. The surgical field is a lot smaller when you're using a robot. It's more efficient. Surgeries are sometimes faster. People get to physical therapy faster. So we have robots as far as doing urological procedures, removing a male's or a man's prostate using a robot. Shorter length of stay, less infection. People leave the hospital sooner. So that is being done for female surgeries and procedures. There's a robot at Imperial Point. Dr. Gates does that kind of work. So robots are being at the cutting edge of where technology and the doctors are being able to practice to the advantage of the patient better medicine.
And I think people should realize a big robot doesn't walk into the operating room. Why don't you explain what you mean?
Absolutely. So this is the same concept as the man van. It needs an explanation. So a robot is basically a physical assist device for the surgeon. They literally sit there and look through what looks like a periscope, just like for the submarine. So they're actually seeing the surgical field. And then in their hands, there are instruments, just like little kids' board games and so on and so forth. You're moving pieces of equipment that are moving in millimeter size increments within a person's body, if they're doing a gallbladder removal or if they're doing a prostate removal. So it's literally microsurgery using the robot, whereas before it would be having to cut the skin and get into the wound to make a large enough incision so that the doctor's hands can fit in there. Now with the robot, you can use smaller instruments, smaller apertures, smaller holes in the human body to do surgery, removing a prostate, removing a uterus, doing procedures inside the mouth or the ear, nose, and throat type procedures. So all these things are available as science, cutting-edge science, to assist the doctors do a better job for better, faster healing for those
Well,
patients.
I was also going to say there's less chance of infection, even though, of course, you make sure of every
Yes.
possible way.
Yeah.
But if your hands aren't inside.
Yeah, so the smaller the wound, the less likely it is that basically an infection happens because there's less of a surface area to be exposed to the environment.
At the speech that you made a week ago, which I thought was just great, I love the idea of trying to prevent accidents. And you made I'm going to let you tell them. I thought that was funny about where the X goes may not be where the problem is.
Of course. So one of the things we try to do is when I talked about safety and satisfaction around, so satisfaction for the patients, for us, is very, very important. Safety is also very, very important. So what happens, and don't be surprised, and if you've had surgery, I'm sure you've noticed, the doctor, the nurse, and the anesthesiologist will stand at the bedside and say, is the cataract in the right eye? You'll have to answer yes. And then you agree to the procedure, and then they actually mark the spot. They may do an X above your right eyebrow to mark where the surgeon should work. And what that does, it ensures that the whole team is paying attention to make sure it's the correct eye, the correct patient, and the correct procedure at the bedside. Very, very important. So safety is a huge, huge initiative that we're undertaking. And it's invisible to the patient, except for that, interaction as far as doing the right side, right patient, right procedure. But behind the scenes, there's a lot of systems, including software and hardware that we use for drug dispensing, for blood management, as far as blood type and which patient it goes to, all of that. That's all behind the scenes.
I remember when I was getting my gerontology degree, there was a course which I loved. It was called Legal Aspects of Aging, and that was the first time that I heard that they operated on the wrong arm, the wrong leg, and
unfortunately
but it happens.
It happens.
Because people are so busy, but this is very good. So it's an extra care.
Yes,
to make
extra care, and for our listeners, it's very important to know that they are part of the equation. So it's a dynamic interaction between the doctor, the nurse, and the patient to make sure that the patient is the right patient, it's the right procedure, and it's the right side.
Well, of course, this is very rare to have the CEO and the president of a physician and also the big-time administrator tell you about all these secrets. Now you have there's no more secrets. You know everything. We go to the hospital, you'll say, well, you heard Dr. Sanadi, El Sanadi, and he told you it was okay, so I'm so happy that you came here, Dr. El Sanadi.
Thank you so much for having me on the show, and I'm looking forward to working with you some more and our listeners. And thank you for being part of the Broward Health family and helping us at the foundation.
It's my privilege.
Please.
Thank
We're
you.
honored. Thank you.
We'll just good luck to what you're doing.
Thank you so much.
All right.